And welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Melody McCloud. She's an obstetrician-gynecologist. Today's Kevin MD article is breaking down the link between social rejection and Black women's health outcomes. Melody, welcome to the show.
Thank you for having me, Kevin, Dr. Foe. I appreciate being here with you and your audience.
So let's start by briefly sharing your story and journey.
Okay, I grew up in New York City. I actually was blessed to have a Black female pediatrician when I was a little girl. We're talking about back in the 60s, Dr. Doris Weathers. And I think she was the inspiration for me to go into medicine because I used to love to go to her office and smell at the time, doctor's offices smelled like rubbing alcohol. And for some reason, I just it just smelled fresh and clean. And I would hear how she helped people feel better. And I really think that had something to do with my inner energies and spirits. I became a candy striper at Columbia Presbyterian. And then I entered college as a pre-med. And one interesting thing, when I was in high school, my high school vice principal and history teacher told my mother, make sure she takes typing because Black people don't become doctors. But I already knew better because I had Dr. Weathers. So I've just had a wonderful life journeying into pre-med, medical, and practicing.
So you're an obstetrician-gynecologist. How's your practice and what's life like today as an obstetrician-gynecologist?
Well, actually, in the last few years, I hate to use the word retired, but I've stepped away from active clinical practice and I'm doing writing, public speaking, some lecturing, some media appearances. But I do miss the active practice of medicine, even though it's a whole different animal out there now. You know, I'm old school, so I'm kind of a purist for our profession and a fierce protector of it. So, but my patients miss me, and I miss surgery, I miss all that. But I'm still involved. You know, of course, I keep up with everything, and I do lectures. I try to lecture to the communities and different organizations, and to medical schools too.
Yeah. So tell me about that transition into a personality where you do that speaking, do that writing. I know a lot of physicians do that outside of clinical medicine. So tell me a little bit about that transition.
Well, actually, even while I was practicing Emory, which is where I trained, and then, you know, I began to I had my own private practice, which is kind of a novelty these days to
Yeah.
have your private practices, you know, but I had an independent practice. I always wanted to hang out my own shingle. And I did that. Had two patients the first day, one at 9:30, one at 3. And I was like, oh, cool. But that didn't last long. So anyway, as a result of my practicing and my patient care, Emory began to send me out to CNN to do Talk Back Live and talk about things like that. So that was kind of the beginning of my doing some public speaking and appearing in the media. And I've always loved to write. And so I kind of began to start writing. And from my lecturing, one thing just kind of led to another. And that's how some books came about and more public speaking. As a result of the books, some public speaking activities came about. But again, it's great, but it's still not the hands-on, you know, experience of surgery and patient care. And I'm still in touch with a lot of my patients.
And I think a lot of physicians, I always advocate for them to be involved in media because they're going to have a much bigger platform to share their health message, right? So if you were to offer one tip for those physicians who want to break into the media, what would that one tip be?
Oh my, you're the one who should say that because you've kind of done that whole thing. I would say one, just make sure that your professional career is intact, you know, hopefully without blemish. And, you know, something I didn't do, which really is maybe get a publicist or an agent. I really haven't done that. And I need probably to even do that now, even with my books. The publishers did some stuff, but I would say get someone if you want to get on out there. And again, I'm an old school lady, so social media is the place to be, as you well know.
Mhm.
And, you know, if that's your thing, either do it yourself or hire someone to maybe start putting you out there on social media, because that seems to be what the issue is. Even with me and my books, I'm not really on social media a lot, but you know, they kind of want you to follow a zillion people and get followed. So right now, in this day and time, make sure you're a physician in good standing, have someone prepare your presentation for you, your media kit, and maybe get a good agent or a publicist and or hire someone to do some social media posting for you to get your name out there.
All right, let's talk about your Kevin MD article titled Breaking Down the Link Between Social Rejection and Black Women's Health Outcomes. For those who didn't get a chance to read your article, tell us what it's about.
Well, as As a physician, of course, I've taken care of women of all walks of life, Black, white, Hispanic, Asian, Native American, across the board. But as we hear, there are different issues that are facing Black women that truthfully other women are not going through. And in my speaking to women in public and going to different seminars, I would hear, yeah, be happy and this and the other, but what about the crap that's coming to
Mhm.
us as Black women? So some of these things are causing anger, emotional pain, affecting our mental health. You may have heard the term recently, microaggressions.
Mhm.
And for people who don't know what that is, it's kind of these little snide little things that people say to us as Black women. And it's a fact. I mean, I get followed when I go into a little gift shop. I have to tell someone, I'm not going to steal your little card with two little earrings on there for $20. So it still happens. And so some of these things, such as, and this is a little insight into the Black community, there's still a thing called colorism, where people my color, more brown, more chocolate, okay, are not as favorably looked upon as the lighter skinned Black women. Okay, it's called colorism, and it happens even with marriages. Okay, that's a problem. And also, too, historically, lighter skinned Blacks were deemed less threatening than brown skinned Blacks. So that's one colorism. I feel too, hip hop lyrics, some of the language in there is very misogynistic, calling people out of their names. That's a problem. We have very low marriage statistics in the Black community, and that affects like your psyche, being desirable to somebody. Our natural beauty is rejected. It's so funny, quite honestly, to many of us as Black people that, we don't have to bake out in the sun to get some color, but white people do and other people do. So why is our natural skin color rejected, but yet people are working hard and spending millions of dollars a year in tanning booths to get what we already naturally have? I say our skin was naturally kissed by the sun, by God. Also, if we get upset about something or respond to something other people have said, we're being a bee or we're being evil. But anyway, all these things are negativities that come at us, truthfully. And what happens is that can cause emotional pain, affect your self-esteem. It can make you angry because you're trying to do the best you can. Quite honestly, even with school, people don't like to hear this, but as a Black person, or maybe and not so much with Asians, because Asians, are like the top of the class in many times, but with Blacks, you have to prove yourself. You have to be better than, in many instances, to be deemed worthy to be there at all. Okay, it's this pressure, this kind of tax. So those things can cause anger and pain. And with that, as the American Heart Association just came out with an article about anger and heart health, that causes stress, as you know, stress and cortisol hormones go up, endorphins go down, and all of that can affect your heart, your blood pressure. It may cause obesity, overeating, stress eating, and all of those things really in turn are conditions that can lead to serious heart disease, heart attacks, stroke, diabetes, and even death.
Now, when you were seeing patients, did you bring up some of these cultural microaggressions that the Black community may have experienced, and how did you address that when you were seeing patients in the exam room?
Actually, I didn't have to do that so much at the time. When I first began practicing, I was the first Black female OBGYN to set up a practice in DeKalb County, Georgia. And as a result of that, I naturally drew a lot of Black patients from the get go. Okay. And so maybe it didn't come up because we were just talking about our own lives. But now that I think about it in retrospect, yes, we were discussing microaggressions and things that we experience. And I just tried to be supportive of my patients in that. And also, too, as a physician, I've experienced some racial attitudes. I'll never forget a few cases, but one in particular, a patient had been flown into an Emory hospital in the wee hours of the morning, or maybe like right around midnight or so. She had what we believe was a ruptured ectopic pregnancy. The
Mhm.
patient was kind of in and out because she was unconscious because her H&H, her hemoglobin, her hematocrit were terribly low. And so they had told her husband that Dr. McCloud is on her way. I was a GYN on call for the ER that night. And so when I got there and I walk in the room, I'm ready to go because, this patient's critical. And sure enough, he said to me, you're the doctor? You're the doctor? Oh no, we're not having some black doctor operate on my wife. And here we have a patient who's, practically who's unconscious in and out. And so it happens. It happens. And I just want people to be aware of that it still happens in many instances.
What about those clinicians who may not have the lived experience of the Black community? How can they be more culturally sensitive to some of the issues that you bring up?
Thank you for that. You may have heard recently this phrase of implicit bias. Okay, you may not realize some of the things that are said. A black person or a person of color, an Indian or whoever, a Hispanic even, it may affect them in a certain way. And also, too, there unfortunately has been a distrust in the black community towards medical professionals, not only because of the syphilis situation years ago with Tuskegee, but some of these stories are passed down. Dr. J. Marion Sims, he's deemed the father of gynecology. He's the one who created the speculum that's used,
Hmm.
the bivalve speculum that we use. But also, back in his day in the 1800s, he perfected repairs of a vesico-vaginal fistula by operating on enslaved black women without anesthesia. Okay, so he perfected, and if you look this up, it's not well known. He perfected that by operating on without anesthesia enslaved black women, so that when he operated on white people, he gave them anesthesia. So just think of that pain, and these stories are still passed down in the black community. So I would encourage non-blacks to just be mindful of these things, and be mindful that there may be some distrust, are you really looking at me as a patient? Are you offering me the same care and test procedures? It's a fact when many blacks go to the emergency room, they may not be considered for heart disease as others might be. So please just be equal and fair in how you treat all all patients. And be aware that we may have some of these sensitivities in our mind, and just show us the same respect that you show other people.
So knowing that there may be an inherent distrust in the Black community when it comes to the medical profession, other than being mindful, are there any questions that we can ask our patients? Anything that we can say to build that trust back up again?
I would say take the time and maybe even ask them, do you have any concerns that I haven't addressed for you?
Mhm.
Just something maybe even as basic and simple as that. Okay, a lot of being a physician, you want to make the patient comfortable with you. And again, we're in a time of short visits, 10 minutes at the most. Some people don't even want to examine patients anymore. I don't like the way a lot of medicine's going these days. It's driving me crazy. So I would just say, just try to keep in mind the sensitivity your patient may have and ask them, is there something on your mind? How are you feeling about some of the issues going on in our society today? That's an open-ended question. And hopefully they'll tell you, I'm a little stressed out by X, Y, or Z. Okay, is there something I can do for you that I haven't addressed that you would like me to just open up a question, an open-ended question to your patients, regardless of their walk of life, but especially to women of color and men too.
Now, how about outside the exam room? Are you aware of any successful community initiatives that have helped improve the health outcomes in ethnic minority populations? Anything to successfully tackle the challenges of these health disparities?
Well, I will say that last year I actually had the honor of addressing CME at Boston University School of Medicine. It was held on Hilton Head Island, which is a great place to
Hmm.
hold CMEs if anyone wants to come on down. And I actually presented to mostly white. In fact, I think last year our audience was totally white, maybe some Indians, but I didn't really, it's mostly a white audience. I presented the story of Dr. Rebecca Lee Crumpler. And for those who don't know, Dr. Rebecca Lee Crumpler was the first Black female physician in the United States, and she graduated from what became, bless her heart, Boston University School of Medicine. Okay, at the time it was called the New England Female Medical College, and she graduated as the Civil War raged in 1864. She graduated from what is now BU School of Medicine.
Hmm.
And then she went to Virginia to treat recently freed slaves that the white doctors did not want to touch. She did that in 1865. So one thing is, people like myself, I'm trying to get the word out even about her history and bringing it forward to today, because she caught hell, as I say. Even some white physicians then disrespected her. Pharmacists didn't want to honor her prescriptions. She was denied hospital privileges at times. In fact, I did a segment on NBC Nightly News about her because she finally got a headstone a couple of years ago up in Boston. So allow for people like myself to advance some of the stories at your conferences, things like that. And also, I wrote a book, Black Women's Wellness, that actually I address a lot of health issues. I encourage you to get it, okay? Because in there I get into looking at the disparities, and I have comparative data of everybody, Black, white, Hispanic, Asian, Native American women, comparatively look at the data and realize that some of these factors, yes, we know about lack of access to care. Yes, we know about lack of insurance. But the fact is, even for those with those things, there's still a big gap and disparity. And I think that's where the anger and the social aggressions, I call it societal stress and Black women's health, the rejection connection. Why is it that everyone, if you have insurance, you have access, you're intelligent, you're smart, you're educated, but you still have these health issues? What is it? And I think it's that psychosocial stress that's affecting people. So I want people to be more aware of that. And I do that through my public speaking and through my writing and through this book, Black Women's Wellness. That was endorsed by Dr. Jen Ashton and Pauletta Washington, by the way, if I can say that.
Now, how about from the patient standpoint? You talk about some of these historical traumas that some in the Black community have. What can they do as patients if they become aware of this connection? What can they do?
Well, one thing in the book, again, I start out telling patients in my writing, one, go in, you have to be your best advocate, especially in this day and time. Okay, you have to just be engaged with your own health care. Okay, and in the beginning of my book, I have a family medical history checklist. So, look and see where you're starting from. Who had diabetes, heart disease, kidney, stroke, Alzheimer's. So I have this checklist for that. Also, in the back of the book, I have a personal inventory. Go ahead and kind of look at yourself. Do you have lesions? Do you have whatever? Take that to your doctor. I tell people to go armed with some questions written down, because you get to the doctor's office, you're a little nervous and you may feel rushed by the physician or the PA or whoever's there, but you are the patient. And I know it's tough in this day and time, but I encourage people, go with your questions written down and just say, no, I'm sorry, please, before you leave, can you please answer this for me? Okay. Also, I encourage people to take someone with you to the doctor's office who may have some medical training, because they may hear something that you don't hear, or they may ask a question that you don't even know to ask. And I tell people also to, don't tell me you don't have money at least for one visit once a year. Right now in this society, everybody's celebrity driven and they buy tickets to Taylor Swift or Beyonce or whoever for hundreds or thousands of dollars, or they're buying clothes or Jimmy Choo shoes or get their hair and their nails done. You have money for one visit a year that could help save your life. So those are some of the things that I tell people. I'm pretty straight up about personal responsibility. Okay. And I put it on both. I put it on the physicians and other healthcare providers. I don't use providers for physicians. I keep that separate. We're physicians. And I also encourage patients, you've got to be proactive, especially in this day and time. I also tell people, get your medical records. Get your medical records. If you have a test done, get the report, because sometimes the office may not get back in touch with you. Make sure you follow up.
We're talking to Melody McCloud. She's an obstetrician-gynecologist. Today's Kevin MD article is breaking down the link between social rejection and Black women's health outcomes. Melody, let's end with some of your take-home messages to the Kevin MD audience.
Thank you. I would say overall, in general, as physicians and medical professionals, to have a patient come to you, to us, is a great honor. We are in a noble profession. To have a patient entrust their body to you is an honor. And I want doctors and other healthcare professionals to walk worthy of that to which we are called. And I really feel it's a calling. I want you to take care of the patient, not the procedures of an insurance company. I want you to document. Don't just rely on check boxes in an electronic medical record. I'm narrative notes tell the patient's story.
Mm-hmm.
Make eye contact with the patient. Examine the patient. Look at the patient. Don't just even with their clothes on. I mean, how do you know the woman doesn't have bruises on her back? If you don't see the skin. So I want us to be responsible and walk worthy of the profession to which we are called. And as a result, and as it pertains to this particular topic of Black women or whatever, I encourage you to get Black Women's Wellness, because I give information in there for everybody to look at the data, look at the comparative data, look at the pains we suffer. And you may see things in there that'll open your eyes and awareness to how we feel as patients, and as your Black colleagues in the workforce.
Melody, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you so much for having me, and thank you for all the work you do in getting word out to everyone. Thank you.